So welcome everybody to today's webinar. My name is Alicia and I'm just going to be working on the back end to manage all of your questions and comments throughout the session and to make sure everything runs technically very smoothly. So without further ado, I'd like to introduce our presenter today, Dr. Dominik Nowak, who will be talking about life after COVID-19 vaccination, something I am certain that we are all very, very excited about. I know I am. I'm ready to travel and to go out into public spaces again. So I think this will be a really engaging session, and I'm really excited to get started. So over to you.
Thank you, Alicia. So we'll talk through a few things today. First, vaccines, generally how they work, safety, benefits. We'll shift that conversation and talk about, once we're fully vaccinated, what can we do, what can't we do? What is society going to look like as well? What is life going to look like once our cases drop, our vaccine rates go up? And then some of the uncertainties for the months ahead. And very quickly, we'll jump into Q&A and kind of a town hall format for everyone to ask questions, share reflections, and go from there. So I do want to thank TELUS Healthcare Centers as well for supporting this conversation, and then also what I'd say as role modeling proactive COVID policies that are based in science and compassion, especially over the last year and a half. And I've had the really great pleasure of working with and being part of this remarkable team. So about me, I'm Dominik Nowak. I'm chair of the TELUS Medical Advisory Council. That's my work as TELUS, and this role looks at thinking about how do we, as large organizations and as companies in Canada, mount a science-based and compassionate response to health issues like COVID-19. What's our responsibility? What's our responsibility also to echo good public health messaging and help Canadians move through and beyond the pandemic? In my clinical work, I'm a family doctor, and then also a faculty at the University of Toronto in family medicine, and then also in the Institute for Pandemics out of the Delwana School of Public Health. So enough about me. I'm thankful for you all for joining us, and I wanted folks to reflect, maybe in the chat here, or even just in your mind. I think too, my work as a family doctor, and I'm fortunate to also help answer questions about vaccines, vaccinate people. And in this work, I get to meet a lot of folks and really wonderful people and who share answers to this question in really beautiful and telling ways. So I'd love to learn more about the folks here. What matters to you most as you get vaccinated, as your loved ones get vaccinated? What do you look forward to most as Canada begins to move beyond this stage of COVID into what I'd call a recovery phase as things get back to normal? Is it hugging a loved one, returning to friends and family, a particular sport or activity, or finally traveling, meeting new people? What part of your regular life are you really excited and optimistic about in the coming months ahead as more people get vaccinated and as you and your loved ones get vaccinated? And I see a few answers coming in. Concerts, travel, see some around loved ones, especially. Keep those coming as we move through the next slide. So I know a lot of folks love to see that. So let's shift gears and talk about vaccines. And regardless of which vaccine you're talking about, there are a few approved in Canada right now, and they're grouped basically into the mRNA vaccines and then the adenovirus vector vaccines. So this is kind of the classic vaccine technology. And either way, regardless of which vaccine you think about and it's approved in Canada, they all work through different ways, but have the same theme of the vaccine behind them. And that's to work with our body's natural immune system to build protection against COVID if we meet it in real life. And I have to say, these vaccines that we have approved in Canada are based on some of the best trials that we've had in vaccine science. And these trials were, these original trials on the vaccines have involved tens of thousands of people, over 100,000 in total. And beyond those original trials that we had, actually worldwide, we've administered over 1 billion vaccines, including the ones approved in Canada. And that's an important point to note, because for the folks who are getting vaccinated now, you're far from being first in line, right? Actually, we've had a ton of vaccines administered worldwide. And it's important to note that we're actually collecting data on these vaccines all the way through on an ongoing basis. And I'll share an example of the the AstraZeneca vaccine and being linked to blood clots, as an example, and something called VITT or VIT. And this is an example where our surveillance system actually worked, because we know that there were enough vaccines administered, enough of this follow-up and monitoring that happened, that we were able to find something very rare that happened with the AstraZeneca vaccine, with a first dose of around 1 in 50,000. That's kind of the clotting risk we're thinking of there. And then around 1 in 600,000 with that second dose. And again, this is in comparison to a person's regular risk of clotting, of getting a blood clot of around over 1 in 800, or 1 in 3 people with COVID who end up in ICU get a blood clot of some sort. So the fact that we were able to find this, such a rare event, means that actually our public health systems are working, our vaccine safety systems are working. And this is, I think, a good news story, and us being able to catch this, shift some of the policy landscape along the way, and realize that vaccines are not perfect. Of course, they take some time to build our body's natural defenses. There are some rare things that happen, like allergic responses and VIT as another example, but they're actually excellent as protection against COVID. So let's talk about that more. Here I have the concept of being fully vaccinated, right? So we think about it as 2 weeks after your final dose of vaccine. Where does that come from? Why do people say it's important to be fully vaccinated before having that really robust protection? So again, all of the vaccines approved in Canada are highly effective in preventing against COVID-19 and its harms. And then there's a lot of this discussion around what it means to be fully vaccinated, what kind of protection you have with 1 dose. So this is data that's really good coming out of Ontario. So I'll give you an example of what this means in day-to-day language. And here you could see that in Ontario, we've actually administered over 10 million doses of vaccine. For 1 million people in Ontario have been fully vaccinated. We know that the vaccines are not perfect and they take some time to work. So this visual that came out of Public Health Ontario shows us of the people who were vaccinated and got COVID later, even though it's a smaller proportion than usual, how many of them still caught COVID and when did they actually get it? So in other words, how long does it actually take to get protected after a vaccine? And you could see here that the majority of cases after vaccination were in that first 14 days after your first dose, when your body is still building up its natural protection. And then after 14 days, quite a big drop from here to here in terms of getting infected after being vaccinated. And then actually, once you get your second dose, even though you have really good protection from here to here after being partially vaccinated with that first dose, after you get your second dose, you could barely see the number of infections, right? That's why it's so important for us to think about that concept of being fully vaccinated as around 14 days after that second dose. And that's really where you have actually remarkable protection against COVID. And this graph also mirrors the harms of COVID as well. So you see the same kind of thing in terms of hospitalizations, needing an intensive care bed, in terms of deaths, all the endpoints that really matter. And the thing that's really amazing in terms of vaccine science, it's out of these around 25,000 people, out of the 10 million or so doses of vaccine that Ontario gave, out of these 25,000 people that still got a COVID infection, only a few dozen of them ended up in hospital, and only a handful of deaths actually happened after vaccination. So it's just remarkable the kind of protection where the vaccination, especially that second dose here, changes something very serious like COVID, where you have a lot of people ending up in hospital, a lot of people losing loved ones, into something like a regular cold or flu, right? So it's just remarkable. And again, this is the same kind of pattern that we saw in, congregate settings and long-term care, and our population over 80 or so, where we have 9 in 10 people, and over 80 already with at least 1 dose of vaccine. So I think we've done a good job at protecting our elders, especially now in this next phase of the pandemic, and in rolling out vaccines. And we're seeing a really great response here. So that's what it means to be fully vaccinated. Let's move on. And we see the same story on a society level with many countries who are actually ahead of us in vaccine rollout. So I think of Israel, United Kingdom, United States, some examples. And they're reopening, schools, malls, travel, indoor sports. They're keeping some layers of protection, like testing, masking indoors, and things like that. So that's an important key, because as we add on this vaccine layer, we could remove some layers, but some layers we'll have to keep. And here you see something very interesting in Canada, because we didn't have domestic vaccine capacity. So we couldn't make vaccine in Canada. So we had a bit less supply than some of these other countries with really fast rollouts. And you might have heard something called the Canadian Compromise. And that's where, if I have two family members, let's say I love them around equally. I don't have a particular favorite family member among the two of them. Maybe if I did, I'd give them both one vaccine. But if I appreciate both family members equally and I have two doses of vaccine, probably what makes sense for me to do is give both of them one of those doses, right? So they both have good protection rather than just one of them having excellent protection and the other one being unprotected. So this is what you see in action here, this Canadian Compromise, where a large proportion of people have their first dose with good protection, and then we're catching up on that second dose as we get more vaccine in Canada. So what does this actually mean for us? And there are two ways that I'll put it. So one is on an individual level. Here I'll share that actually, this vaccine rollout that we're having in Canada means that our lives are going to go back to normal in the coming few months. Pandemic's going to end. This is going to end. And it's important to start thinking about how you'll reintegrate to society, safely return to the things that you may have sacrificed this last year and a half. Do some of the things that folks mentioned that really matter to them. Hugging family members, spending time with loved ones, traveling, concerts, some of the things that we've given up to help Canada move through the pandemic. And then on a society level, more broadly, we're probably going to start to see things move relatively quickly compared to what we're used to. As our vaccine layer comes into play, as more people get that second dose, especially, we'll be able to start peeling off some of those layers of protection and moving out of this pandemic phase into this recovery phase, as we shared earlier. And we're starting to see that already right now. So, this summer, we're starting to see case rates drop, a lot of people having at least one dose, more and more people with two. We're seeing a reopening of safe outdoor activities, again, with some precautions. It's like patios, picnics, camping. A lot of these things are very safe. Outdoor activities, very safe for us to see our loved ones, especially as our provinces start to reopen. And then in the fall, our cases are low, our two-dose coverage increases, so more and more people get that second dose. We'll probably see school, universities, indoor sports, family gatherings. It's remarkable to think that probably in a few months we'll have a very normal Thanksgiving, right after a year and a half of being creative, right, around how we see our loved ones and how we form memories with our families and other people that are close to us. And we'll feel safe in these kind of contexts, right? Knowing that we're protected, knowing that our family members are protected, knowing that COVID is actually low, that vaccine rates are high, and everything like that. So that's to say that all the public health measures that we have in place right now are intended to be temporary. They're probably going to be peeled off in the coming months ahead. And at the same time, it's important to get vaccinated, because a lot of this depends on people getting vaccinated and that shared protection, right, of people being vaccinated together to protect their loved ones and their family members and themselves as well. So where are we going from here? There are some things we know, some things that we don't know. What we know are that the vaccines work. We saw that earlier, the example being the Ontario data from the 10 million or so doses, and other examples, from the billion or more doses that we've administered worldwide for COVID. And we'll have to think about individually as well in the coming months, how will each relearn how to, what it's like to be in society. As measures are lifted, it's important for us to actually go out, start to see people, start to learn how to live again. Think about what's important for our own mental health. as well as we learn to socialize again in person and everything like that. And at the same time, follow some of the things we've learned in the pandemic, especially in higher risk places like places that are shared indoors, where you don't really know whether a lot of folks have been vaccinated or not, and so forth. So things like masking in shared indoor places, washing our hands, things like that. That said, the rates are good across the country, and so are our vaccine rates in terms of people getting their first dose and then their second dose. So we have a lot of reason for optimism. And within this optimism, probably what we'll see is, again, this peeling off of layers of protection, as I call it, still with some of these caveats in mind. Of there are a few things that we don't know, right? So what we don't know are, when do we need a booster dose and how soon? How long does immunity last? What are going to be the impacts of the variants, right? Like the variant of concern, Delta, as it's being called in Canada, as that takes over our case rates in Ontario and other places in Canada. If things begin to worsen, so let's say folks who aren't vaccinated, aren't fully vaccinated, aren't fully protected start to get infected with variant Delta, do we have to add on some additional measures and go back maybe a month or two? But that said, there's no reason to think that's going to be the case. I don't think we'll go back to where things were a year ago. There are a lot of things that work well, vaccines, being outdoors, and so forth. And although there are a few things that we don't know yet, this is still a lot of room for optimism. So the 4 things that will be important to watch in the next few months, they'll shape some of how Canada does. First, again, continuing layers of protection, especially in places that are shared indoors or with strangers. That'll be important. Probably masking is going to be a thing still in shared places, even if we peel it off in places with our loved ones, family members, or in places where we know there are high vaccine rates. Next, it'll be important for us to think about how we're doing in building vaccine confidence. So for folks who have very good questions around getting a vaccine, how are we answering those questions? How are we making sure that people are confident in getting vaccinated, protecting themselves, protecting their loved ones, and then maintaining that shared protection that comes from a large proportion of Canadians getting both shots. The third one is anticipating some of the variant conversation, like variant of concern Delta. We know, for example, Delta is more transmissible, hits people harder in terms of sickness and hospitalization rates, and the vaccines are probably less protective against it. That said, we know that the second dose still does the trick, that it works well against the variants. And then finally, we'll have to think about how are we doing in terms of vaccinating youth and protecting them, protecting teachers and other essential workers as we look to reopen schools, which is really important as a society. So with those 4 caveats, or room for improvement for Canada in mind, I want to thank the folks here for coming to this conversation, also for getting vaccinated, getting your loved ones vaccinated. I think it's about shared purpose, protecting ourselves, protecting our communities as well, and doing some of the things that people shared earlier that we've all sacrificed over the last year and a half to help get Canada through the pandemic and help protect our families from this really terrible disease that's been COVID. And at the same time, lots of optimism for where things are going to go in the months ahead. So I think we'll stop there, and we'll go into some of the town hall format and Q&A. And again, thank you for sharing the time together.
Great. Well, we've got lots of questions coming in. It's really nice to kind of have a conversation about COVID that's more optimistic, for sure, rather than like pessimistic and just, when is this going to end, et cetera, et cetera. So the first question I wanted to ask is, people that are having these questions just about COVID, but the vaccine generally, where can people go for reliable information on this topic?
This is one of my favorite questions, because I think a lot of folks think about, when they hear health professional, they think of the celebrity doctors or, House, or someone that's in the media. And one of the best sources of good personalized advice is actually your family doctor or your primary care professional or a health professional that you trust, that knows you well, that knows your situation and knows your values. And I see that as the best place to have a conversation around vaccines, especially if you have some really good questions. The other places I look to are some of the local public health units or regions, right? Oftentimes they have specific Twitter accounts or social media accounts, very particular to where you live for your community. And that's a great place to get personalized advice for your, specifically for where you are locally, how your, your community's epidemic is doing, how your own vaccine rollout in that community is doing. And the last place I'd share is a place I've been sharing with a lot of my patients in terms of actually getting a vaccine. Sometimes it can be very confusing to find a vaccine, especially in the second dose conversation now. And that's vaccine hunters as well. So this is a group, it's grassroots, helping people find vaccine sites, vaccine hubs, pop-up clinics, and everything like that in their own communities throughout Canada. So that's a fabulous resource as well.
And so did you say it was called Vaccine Hunters?
Yep, vaccinehunters.ca.
I'll just pop that in the chat just in case anybody wants to take a look on their own. So there's lots of questions, actually. I'm going to try to sum them up into one about people who are wondering how they're going to be able to continue to interact with people who choose not to get vaccinated.
It's a good question, and I think of this in terms of layers of safety, right? So we know that the vaccine layer is really important in terms of protecting us, and also it helps prevent transmission, probably protect our loved ones and family members. The person who's most protected by getting vaccinated is you, right? So if you get vaccine and you get both doses, actually you have quite good protections, and that's why we say folks who are vaccinated can probably start peeling off some of those layers of safety in the coming few months. And then there's this concept of shared protection, right? So if enough people are vaccinated, for folks who have very legitimate reasons not to get vaccinated, they can still have this shared protection if enough folks in the community are vaccinated. That said, it'll be based on personal preference in terms of if you're in a gathering, let's say in a few months, and you don't know whether folks are vaccinated, do you still want to have masks? Do you still want to do it outdoors? Do you want to have some of those additional layers of safety just in case, right? Even especially if you feel that you have a few folks there who may not be vaccinated, may not have that shared protection in that gathering, or it's a gathering of strangers, let's say, or a concert or something like that.
So being fully vaccinated, just to make sure that I'm totally clear, it's the main reason to be concerned about being other places where people are not vaccinated is just to prevent the further transmission. But if you are fully vaccinated and you're in a place where people are not vaccinated, would you consider yourself like 99% protected?
So it's not 99%, it's probably something like 90 to 95% protected in terms of actually getting COVID, and then nearly perfect in terms of getting serious COVID, so getting into hospital or dying from COVID. If you have 2 doses of vaccine and then you're 2 weeks after your second dose. So I'd say, as folks get fully vaccinated, they actually have very good personal protection, even if they come across with someone with COVID in public.
So then if you are fully vaccinated, can you still give COVID to somebody else?
And that's the key here, right? That's why we want to have people vaccinated, but also drive down case rates, because the vaccines aren't perfect, right? So theoretically, even though I'm vaccinated, and let's say a family member of mine is vaccinated, we know that older adults, for example, or people with immune compromise, don't mount as good of an immune response to the vaccines. So let's say I get sick from COVID, I don't get as sick, I'm vaccinated, but I could also transmit it to someone else in my life, and they may not have the same kind of protection that I do. That's why it's still important for us all, even for those of us who already had a reasonably low risk of getting very sick from COVID, to get vaccinated, to protect ourselves, and then also, exactly to your point, Alicia, to prevent transmission as well to others.
Totally. So when it comes to the vaccine, and I believe this is the Canadian compromise where some people got vaccines in March, now are just getting their second doses in June. How is that going to affect the effectiveness of the vaccine?
You mean the delayed dose, right? The delayed
Yeah.
second dose. Yeah, it's a good question, and ultimately, the reality is that one dose of the vaccines that are approved in Canada is quite good. And then that second dose is kind of like that second layer of paint once that first layer dries. So it tops up your immune system. It helps you build a bit more of that natural immunity. Um, and it'll be important, especially now with some of what's coming out of the United Kingdom and other places of the world with the variant of concern Delta, for places that are higher risk in terms of having Delta and uh, having a lot of people infected from variant of concern Delta, to probably accelerate that second dose sooner than originally we planned to, because we know that for the variants, it's actually really important to have both doses of vaccine rather than just one. So that's the comment I'd make here. Probably what we're going to see, and this has already started to happen in many of the provinces, is that we're going to start shifting forward that original Canadian compromise to start giving more and more people their second doses.
Okay. Yeah, that makes sense. It's such an interesting peculiarity associated with Canada
Mm-hmm.
for sure, because you see other places in the world and they seem to be on a regular track, and then here they're
Yeah.
not. So when we're fully vaccinated, I think that some of the next questions are kind of more about what you can do, I suppose. So if I'm fully vaccinated, as an example, and I would like to go over to my parents' house, but let's say my parents don't want to get vaccinated, what can I do to kind of about that situation? Can I encourage
It's
them? Should I stay away? Like, what's the
Yeah,
best practice?
so there is going to be some shared protection from, if where you live locally, let's say you're in Peel or uh, Vancouver or whatever else, and you have low case rates, so COVID isn't spreading a lot in that area, and then also high vaccine rates, there's going to be a point at which we say probably the shared protection that comes from that makes it be okay to peel back a lot of the layers of protection. So, you wouldn't need to see your parents with masks or outside or anything like that. Until that day comes, especially for folks in our lives who aren't vaccinated, who we want to protect, even though we're vaccinated, it'll probably still be important to layer the protections, right? So be outdoors when we can, especially with our case rates. Still, they're getting better, but they're not zero. Our vaccine rates are getting better, but again, they're not where we need them to be to actually fully reopen. So the layers of protection that I think of in lieu of vaccines, especially if you're in a crowd or in a group where some people don't have a vaccine and you want to protect them, are being outdoors, wearing a mask, especially if you need to be inside for periods, things like that.
So if I had my full vaccine and I wanted to, like at this point, it's after 2 weeks, like I'm fully vaccinated and I wanted to hug my nieces and nephews and that kind of
Mhm.
thing, would that sort of stuff be okay, or would it still be important to wear the mask and make sure everybody's been socially distant, etc.?
Yeah. This guidance is coming out of the Center for Disease Control in the US. It's not it's not live yet in Canada, but I think we'll start to see some guidance, I hope, in terms of what people who have been fully vaccinated can do in Canada. And what the CDC says in the States is if you've been fully vaccinated, then you could actually go into other gatherings with other people who are fully vaccinated without masks, without distancing, hug someone else that's been fully vaccinated, everything like that. So that's probably what we'll start to see live in Canada within the next few months as more people actually get fully vaccinated. I think the delay here is that a lot of Canadians haven't actually yet been fully vaccinated. We saw that number of 7 or 8% versus over 60% or so of adults having just that one dose. But as we catch up to the States, probably some of this guidance is going to go live where we'll have public health say, actually, yes, if you've been fully vaccinated and your family member has been fully vaccinated, you don't need to mask. You don't need to necessarily be outdoors. You could be inside together, give your loved one a hug and everything like that, which is just a remarkable thing to think about, especially after a year and a half of being really careful around everyone, especially those that we love.
Yeah, No, I remember the first hug that I'd had when the restrictions in Vancouver started to ease after not touching anybody for a month and a
Yeah,
half. I almost cried. It's an amazing thing, that physical contact that we miss so much in our lives. And so I think that's a
yeah.
really exciting thing to look forward to. On the topic of the US and I guess travel generally, do they have any idea yet of what to expect in terms of when the borders and travel restrictions will ease and getting rid of the quarantine upon arrival and that kind of stuff?
Yeah, interestingly, over the last few months, probably we've been more of a risk from Canada into the States than the other way around, from the cases and the slower vaccine rollout and everything like that here. Probably what will happen is that for folks who are fully vaccinated, some of the policies around quarantine will be removed, right? We know that if you're fully vaccinated, you're at such low risk of spreading it to other people or picking up COVID, even if you get exposed, that already we have policy that you don't need to quarantine after an exposure if you're fully vaccinated. So 2 doses and 2 weeks after your second dose. And we know that's probably true as well for travel. So even if you're exposed during travel or you pick it up internationally, if you're fully vaccinated, as long as you don't have any symptoms, probably what we'll start to see happen is saying, you know what, you actually don't need to stay away from others for those 2 weeks. You're safe enough because you have that protection, you have that immunity that you're unlikely to bring back COVID. But it's a good question because we'll start to see probably we've already seen this in large numbers actually, this global effort towards vaccinating, because we're fortunate to live in a country with access to vaccines, finances to fund that, a relatively good healthcare system to deploy vaccines and everything like that. But a lot of countries in the world don't have the vaccine rollout that we do. And what we're going to see is that a lot of countries will still have very big COVID epidemics, even as ours settles, right? So it'll be important for us to think about this as a global community. What are we as Canadians doing to support globally COVID, right, in other countries as well? Because we know that if COVID is spreading in large numbers anywhere, new variants can emerge. It can come back to Canada as well, and at the end of the day, it can impact us again with how connected the world is right now.
Yeah, the variants are definitely a scary thing. There's quite a few questions in here about them, so I'm going to try to go through a couple of these questions here. The first one that I saw was, how are the variants affecting kids under 12, and how should we be protecting these children against those who are not eligible for the vaccine yet?
Mm-hmm. The I'll mention the study on children, so 12 and older, for the vaccines actually showed remarkable protection. So near essentially perfect protection against various strains of COVID for children who had both doses of their vaccine. So it'll be very important for us to vaccinate kiddos as schools start up again, as we go back into kind of our regular routines. And that's going to be the number one layer of safety. And then the number two layer of safety that we could probably count on as our vaccines increase is, this concept of herd immunity, right? So if you have a group of 10 people and then one of them gets sick from COVID, but then the rest of them are vaccinated, it's highly unlikely for that one person who gets sick to spread it to the others if they're already protected, if they have immunity. So that infection will stop with that one person. That's the concept of herd immunity, and that's why it's so important for us to increase our vaccine rates throughout Canada, because there's this, beyond this individual protection, Alicia, that we spoke about earlier. Let's say I'm vaccinated, I have that second dose, it's a few weeks after that second dose. If enough of us are vaccinated, we have actually that shared protection for others who, for whatever reason, can't get vaccinated.
Yeah, it's a really good point. So these, I guess, with the variants, do you think that'll slow down the reopening at all of things, just because we still don't know as much about them yet, or
Mm-hmm.
what do you think is going to happen there?
They're definitely a question mark in terms of how they'll play out in Canada. But we already know some of the lessons learned from other countries that are dealing with variants, in particular the variant of concern Delta, as we call it now. and that is the 2 doses of vaccine are actually very effective against the variants. And then we also know that public health measures, so outdoors, distance, masks, all the things that we're doing on a day-to-day basis right now are very effective against variants, Delta or otherwise so far. And there's no reason to think that there are going to be necessarily variants that contravene this, although it is a question mark. I think what's going to happen is, Delta will spread. It'll become the dominant variant. So the highest number of COVID cases will be from Delta throughout Canada. Probably this is what usually happens with variants. And just like we're seeing in other countries, probably the people that are going to get hit by Delta hardest are the ones that aren't vaccinated, unfortunately. And then the folks who do have, one shot or both shots have quite good protection against Delta. That's why there's this real urgency to vaccinate more people with their second dose and protect more people with that fully vaccinated protection, especially in hotspots, especially in places where we know realistically Delta is going to take over in the coming few weeks ahead.
Yeah, it's very, very interesting.
That said, I don't think we're going to go back to kind of the previous lockdowns and stay-at-home measures and everything like that. I think we're advanced enough in terms of vaccine rollout that we'll be able to outrace this with vaccination.
I would say I really hope so. That would be it would be just devastating to have to go into that lockdown. And I mean, I don't know if people would be able to go through it again.
Yeah.
I think there would be a lot more rebelling rather than adherence. So going back to the vaccine itself again, there's a few questions in here about the difference between if you had your first dose as AstraZeneca and then getting a second dose that's a non-AstraZeneca dose. Like, how does getting a different type of vaccine impact your immunity generally?
This is something that's been a new development in Canada as of a few weeks ago. So we know that Canada released guidance that said, you had your first dose of AstraZeneca, great, you did the right thing. You took that first step to being fully vaccinated, to protecting yourself, your community, and so forth. And now that we actually don't have a lot of doses of AstraZeneca left, we have this, new understanding of blood clot risk with AstraZeneca, where we don't necessarily want to give those first doses out anymore. What do people do that had a first dose of AstraZeneca now? And the answer here is actually you could go either way. So there's a side of this that says, the original studies were on AstraZeneca and then a second dose of AstraZeneca. And if you're kind of a purist in terms of the science behind this, you'd go that way and say, what, my risk of blood clots with that second dose is significantly lower than with the first dose. First dose blood clot risk was something like 1 in 50,000, compared to an average person's risk of 1 in 800 per year of blood clots, by the way. And my second dose risk of blood clots is something like 1 in 600,000, so even less by an order of magnitude. So you could go that way and say, if I had my first dose of AstraZeneca, I want to listen to the trials, I'm going to go ahead with my second dose of AstraZeneca as well. The other way to take this is to notice some of the emerging literature around the variants and some of the science of the vaccines and mixing vaccines as well that's coming out internationally. And this camp would say, actually, if you mix vaccines, your immune system is going to be even more improved from that mixture. And maybe you'll have more protection against the variants if you mix vaccines. So this camp would say, if you had your first dose of AstraZeneca, actually, think about getting an mRNA vaccine, like a Pfizer or Moderna, as your second dose. And a lot of my colleagues are in either camp, right? And when this happens in medicine and in public health, it means that actually both sides are somewhat right. And you could actually go for either side and have quite good protection. Probably the bottom line here is it's more important to have 2 doses and be a few weeks out from that second dose than it is to kind of pick and choose between which second dose you get. That's the bottom line. So whichever one probably you can get sooner is a good idea. Maybe there's some reason to go for one over the other, maybe an mRNA vaccine like Pfizer and Moderna as your second dose. But if you have to wait for it, just get whichever second dose you can.
And then if you have one like Moderna first, would you want to get Moderna again, or would it matter if you got Pfizer?
Yeah, if there aren't any supply, challenges or anything like that, then I would just stick with the same mRNA vaccine that you got originally, because that's what the studies show. That's where the data is in terms of if you had a Pfizer first, get a Pfizer as your second dose. If you had a Moderna as your first dose, get a Moderna as your second dose. And there are no kind of practical differences between the two mRNA vaccines. They're both excellent, as is the AstraZeneca vaccine as well, despite what we've learned about in terms of the small rare risk of clotting, especially after that first dose.
And then are people for their second dose for the most part getting to choose what they get, or is it kind of like when you go there you don't get an option, you kind of have to come back another day if they don't if you want?
It depends on the province and also where you get your shots. So if you're, for example, in Ontario, you could actually kind of pick and choose which vaccine hub or which pharmacy, which office you go to get your shot. And depending on where you go, they're administering different things. So usually if you're going to a specific site, you can find out ahead of time if it's one of the mRNA vaccines or if they're actually doing some of the second dose AstraZeneca vaccines as well at that site.
And then I have a question here about, and I didn't know this was about this, so maybe you can provide a little more insight. This individual is wondering if you can explain why those who got AstraZeneca have to wait 12 weeks for a second dose, but others can have their second after 28 days.
It's controversial, right? It's a good question, and it's something that I hope will change in the coming few weeks ahead, because we know that one dose of vaccine isn't fully protective, especially against the variants of concern that are emerging, especially in those hotspots for the variants that we're predictably going to see throughout Canada in the coming few weeks ahead. So, what we're seeing internationally is that you can have the second dose at 12 weeks for one of the vaccines after your initial dose of AstraZeneca, but probably what's better is to have it 4 to 8 weeks after your first dose, especially since they're different vaccines. They work in slightly different ways. So, I hope that we'll see this kind of policy decision soon so that we could get the folks who made a really good decision actually to get that AstraZeneca as their first dose, get them protected with that second dose, whichever vaccine it is, whether it's Pfizer, Moderna, or AstraZeneca.
Yeah, I would really hope so. I mean, I know in BC in particular, like it's also been really challenging just to even get an appointment and clogged phone lines and all of that kind of stuff. But it's exciting to see the developments on this side for sure, and just learning more about it and when to get what and how to get it. But it's definitely can be confusing. So thank you for taking the time to explain that.
Absolutely.
When it comes to getting a booster, do you think this is going to be something that's going to come down the pipe anytime soon, or do you think that it's still more research kind of thing?
The short answer is we don't know for sure. I do think there's a realistic chance that there will be boosters coming out. And the good thing about the technologies that we have right now from the COVID vaccines, particularly the mRNA vaccines, is that we could actually adjust them rather quickly in terms of the new strains of COVID coming out and protecting against those. So what we will probably see in the coming few months ahead is some more news around how long does immunity last from the vaccines. We'll start to see the results of the longer term trials in terms of when are people getting infected even after those two doses, and we'll start to see some science around when do we need that top up dose even though we've been fully vaccinated. Is it a year? Is it 2 years? What will that look like? Can you have any vaccine as that top up dose, and so forth? So the jury's still out on this. We'll start to see some more science. Probably what we'll see is something similar to what we see year to year in terms of flu shot campaigns. So getting people that top-up dose to get them the best possible protection every single year before the indoor season starts that year.
Has there been any data on kind of the flu rate in this past year and a half and how that's compared to a typical season?
Yes, what we've actually seen is because of the public health measures, because of the excellent hand washing, distancing, the masking, everything else that we had, we crushed our flu season, where we had barely any flu circulating. Between public health measures and really successful flu shot campaigns, this last winter, we barely had any flu in our Canadian communities, and we actually probably eliminated one strain of flu, which is just remarkable that essentially a few months of public health measures can eliminate an entire strain of flu, and that we haven't seen one of the key strains for essentially for the last year or so. So this is, I think, a learning for the coming decades and years ahead, and that as flu season approaches, maybe we have some of these layers on a regular basis. Not as much as through COVID. Flu isn't as serious as COVID, but maybe we just have some of these layers naturally to drive down our flu rates in a regular flu season.
Yeah, that was going to be my next question, is when you see things like masking and other safety issues, safety protocols, measures like that being removed, like glass panes in front of all of the reception desks and those kinds of things. I mean, it's helpful in preventing flu, that's great, but it also can be a pain to wear a mask inside every building that you go into all the time.
Yeah, exactly. I think we'll start to see some of these layers getting peeled off. The vaccine layer is quite good. I think of it in terms of kind of the Swiss cheese model, as we call it, in terms of transmission and safety, right? So all of the layers that we have are good. They're not perfect. They're kind of like pieces of Swiss cheese, right? They have holes, right? But if you stack multiple layers of Swiss cheese, it's less likely for your sandwich to have any holes in total. And the vaccine layer of Swiss cheese is a big layer. So if you add on the vaccine layer, actually you could peel off some of those other layers of Swiss cheese and be okay. And probably masking, certainly outdoors, maybe one of those layers that we peel off soon. We're starting to see that policy happen throughout the world and in Canada. So, but I do think for certain environments, let's say indoors with strangers, with people that we don't know what their vaccine status is and everything like that, we'll have to have many of those layers, even though we have some of the vaccine rollout happening, until we know for sure that a large enough proportion of our fellow Canadians are vaccinated. I do think that there are some lessons learned for healthcare in general as well, because I see healthcare as just continuing on with masks for the foreseeable future, or during regular flu season, we just start to wear masks in clinic, let's say every October or November for a few months to protect our patients as well, and then to protect ourselves.
Totally. So I mean, maybe not just healthcare providers, but employers in general, when they do start to lift those restrictions on the safety measures you have to have, would you recommend to that employer to keep the plexiglass in the storage closet just in case that something like this comes back? Or what's that kind of approach, do you think?
What I hope happens is as vaccine rates increase in Canada, a lot of the layers we could start peeling off. And my hope is that a lot of the things that we had, we can get rid of. So, maybe plexiglass is one of those, maybe masking. We'll start to see some of those trends and see what actually makes a difference in other countries in the coming months ahead. Probably the important one to keep for now is distancing, right? Especially in indoor environments. And then also in indoor shared environments like concerts and things like that, probably masking is very important as well. But you mentioned some of the other ones like plexiglass and things like that we probably will see maybe start to drop in the coming months ahead as our vaccine rates go up, and then some of our case rates continue to be low, hopefully.
Do you expect that, I'm going to change the topic slightly again, that vaccine passports are going to become a thing worldwide?
It's a controversial topic, and the way I always preface this with, we being mindful of a lot of the injustices that continue to happen throughout Canada, and especially reflecting on the discovery, right? The unsurprising but shocking discovery of the unmarked burial of 215 children at a residential school in BC, and thinking through how we have to consider policy and health policy with a lens that also does no harm and also owns some of the places where we as healthcare, we as medicine, and we as public health have done harm and actually injustice to people, to communities living in Canada. And I think vaccine passports have to be one of those things where we consider, are we, what are the reasons we're doing this for? And maybe are there any other ways to do this? And are there communities that we're risking losing trust if we force vaccinations, right? So I think this conversation is still ongoing. I think we do need to be mindful of the history of oppression and injustice that we need to own as Canadians as well, in light of what we're discovering, especially in the last few years. That's unsurprising, but also no less shocking. And we'll see how this plays out in terms of a policy decision. That said, I do agree that places are safer when more people are vaccinated. So I think it'll be up to us to build vaccine confidence, rebuild trust as healthcare, as institutions, as people, and as family members, where maybe we've lost it in the past, and help us move together beyond the pandemic, especially through vaccination.
Yeah, it's a challenging thing when you can see both sides of how it could be beneficial, but also harmful at the same time.
Mm-hmm.
So yeah, it's tough. It really is tough. I guess my next question, I would like to try to end on a more optimistic and positive note. I guess what would you see as, I mean, maybe this isn't necessarily optimistic, but like all of these people who have now gone through major life events and milestones within the pandemic, like for me, for example, 30th birthday is coming up in October. Who knows if I'll get to properly celebrate it? People that got married, kids that did their graduations and they didn't get that full experience. What do you think things are going to be like following the pandemic? Or do you think we'll start to see lots of these like big celebrations to kind of go back and like throw back to COVID's over kind of thing? Or do you think that, like, how do you think that'll impact people generally, those missed events?
First of all, happy 30th, almost 30th birthday. What I think we'll see, and this is again hope and speculation on my part, not medical opinion. I think we'll see is a resurgence of optimism, of hope. Traditionally, the toughest periods in history have been followed by some of the most prosperous, happiest, healthiest periods. And especially now with such a refocus on health, mental health, we've actually had a lot of learnings as a society, as a health system, and more broadly, as a community of Canadians through the pandemic. I think we'll see kind of a renaissance and a restart of a lot of things that are actually happy news, right? So focusing on spending time with loved ones, probably a lot of events going on that were postponed, and probably this period of time, especially now where folks are excited to be with each other, are really thankful to be with each other, and moving on together in light of this actually devastating shared experience that we've all seen in the last year and a half.
And what advice would you offer to people who are still kind of struggling to see the end? And like, I know it's hard because you see all these exciting things coming in the news. Yes, it's coming, and then it gets delayed and it doesn't happen. And how would you encourage people to stay optimistic?
We're close to the finish line here, right? So and this is the key here is in previous versions of kind of our closing and reopening and everything like that, we've seen this for the provinces, we actually didn't have the vaccines as a tool, as a safety layer, and now we do. And vaccines are quite good in terms of protecting us and protecting our loved ones from COVID. So I'm very optimistic to say that actually we're near the finish line, and it's really now just about still focus on the public health recommendations, still wear a mask in public places, but now's the time to start thinking about what's important to you, what matters to you, how do you get back to the day-to-day things that you were really missing, obviously in a safe way as the coming few months ahead progress. But I see us as going firmly in that direction, especially with the rollout that we're having in Canada.
Yeah, it's really exciting. Well, we have a couple more minutes, but I wanted to, just in case anybody has to take off a couple minutes early, I wanted to see if you had some advice for where people could go generally for any questions following this webinar. I think maybe on the next slide, there might be an email address that we can just put up there. Nope, that's not the right slide. Still have questions, yes. So if you do have any questions, if your question was not answered today and you wanted to send an email to carecenters@telus.com, we will do our best to follow up with you as soon as possible and get answers to your more specific questions. And I think maybe I'll give everybody the gift of time back, and we'll end on that optimistic note, unless Dr. Nowak, you have anything else you wanted to offer to anybody as some parting words of wisdom.
Yeah, I think that's remarkable, Alicia, and I just want to say thank you for the group here, for sharing your time, for doing what you're doing in your communities, and then also for getting vaccinated, encouraging your loved ones and whoever you're in touch with to get vaccinated as well, to help move us beyond the pandemic. And again, thank you for sharing the time with me today. It was really a pleasure.
Great, thank you so much. Enjoy the rest of your day.